In this chapter, we're going to go over the lymphatic system, which is very closely tied to our cardiovascular system and our immune systems. And now, why is that? Take a look at this next slide. If you remember here, as our blood is getting passed through our arterioles, our capillaries, back to our venules, what's going to happen? We're going to have all that blood pressure force out a lot of this liquid. And of course, solutes can either go through exocytosis, cross through, or can also go through those pores, those fenestrations into this interstitial fluid and tissues, which can then enter into our tissue cell. Now, coming after this capillary bed, what do we have? We have this venule end. You remember in chapter 10, we looked at the different types of blood proteins. We have albumin, we have fibrin, we have a lot of the clotting proteins. All of those are going to be found here still within our blood. And if you remember osmosis, what does osmosis do? It's a movement only of water from an area where there's a low concentration of solutes to an area where there's a higher concentration of solutes. And as we return back to our heart, all that water that's found here in this interstitial region is going to come back into our venule end, and then that's how we can have osmotic pressure be that driving force of how we can get liquid back into our blood flow. Now, what happens after this? So let me just erase this really quick. What happens when you still have some remaining and residual fluid still left here in this tissue surrounding your capillary bed and your venule bed? If we don't get any of this fluid back into our blood flow, what can happen is we can have edema. Okay, so especially if you're in the airplane for a long extended periods of time, you don't exercise, you don't move around your lower limbs, and you're stuck in that one same position, you're not exercising, you're not using your skeletal muscles to start pumping all of that extra fluid back into your blood flow. Also, lower pressure at higher altitudes, we have more fluid here in the surrounding tissues, which gives rise to that edema appearance. Now, here is this illustration once more of why we're going to have osmotic pressure at our venule end. Remember, we're coming straight from our heart, all of that systolic pressure from the ventricles. So as our ventricles contract, we're going to have higher pressure getting pumped out from our aorta to our arteries into our arterioles. And because of that, we're going to force out all of those small solutes that can fit through pores. And we can also force out fluid into our capillary bed. At this venule end, we have lower pressure than our capillaries. So how are we going to draw back that fluid into our venules? By osmotic pressure. So this is blood pressure. And really, the ability for us to take back all of this external fluid, all in this interstitial space, and to prevent edema, we have what's called the lymphatic system. And so the lymphatic system, you're going to always notice that here are lymphatic capillaries and lymphatic vessels. They're going to be surrounding our capillary beds, and their job is to soak up and suck up any of this interstitial fluid back into our body, and that way we can restore our blood volume, and that way we don't have any loss of those blood volume in our tissues. So what is our lymphatic system composed of? It's composed of lymphatic vessels, lymphatic tissues or lymphoid tissues, and organs. And here we have those capillaries, so lymph capillaries down here. We have lymph collecting vessels, and we have these structures here called lymph nodes. And at these lymph nodes, we have specialized cells called macrophages, we have B lymphocytes, T cells, T lymphocytes, and what they're going to do is they're going to start screening all of this fluid that's getting soaked up surrounding all this tissue as we bring all this fluid back towards our heart. So this is how we can use this lymphatic system as part of our immune system. We can screen anything that's passing through and surrounding our capillary beds. So we can transport lymph, and lymph is what we call all of that interstitial fluid. Interstitial fluid that has escaped at the capillary bed. Okay, so that's what lymph is. And also what do we have here within these lymph nodes? They house phagocytes that we need for body defenses and resistance to disease. So a couple of things. What can we find here? We can find dead and dying, worn out cells. If there's any cancer cells in this area, any cancer cells can also get taken up into these capillaries and lymphatic vessels and start getting screened at the cells found within these lymph nodes. And also any cell that's infected by a virus or bacteria. And this is how, once again, we can give rise to building up that immune system and gaining resistance to different diseases. Here's a closer look at all of these capillaries comprising that lymphatic system. Everything here are those capillaries. And of course, you're always going to find these capillaries surrounding capillary beds of the cardiovascular system. So location, you'll find lymphatic capillaries surrounding capillary beds of the cardiovascular system. And if we take a closer look at these capillaries, we're going to notice that there is some sort of overlap. And we also have valves. And the way this is going to work is that any time you have fluid surrounding these capillary beds, as you move, all of this fluid is going to get into your capillary of the lymphatic system. Now, once there's a lot of pressure here, what's going to happen? It's going to shut this valve closed. And so we have passive movement of lymph into lymphatic capillary. Also, when you contract your muscles, it's also forcing all that lymph into your lymphatic capillary. So, and we can shut close capillary valves when fluid is inside. And why is that? Because we have this one-way closure, just like your heart. Whenever there's a lot of pressure, a lot of components inside this chamber, you're going to shut this valve closed. It's going to go in that direction. Now we also can anchor down our capillaries by filaments. And so these filaments are going to anchor them down at the lateral regions. Now, how do we collect all of this lymph? And if you notice here, this lymph is just these lymphatic vessels and nodes are distributed all throughout your entire body. Here, if we notice, we're going to have all these capillaries, and if you of course notice, here you have your cardiovascular system, wherever you're going to have capillary beds and also your cardiovascular system vessels. You're also going to see these lymphatic vessels and lymphatic capillaries. Now, I also want you to notice here how we can drain all of these lymphatic vessels and those lymphatic capillaries. And so just like your body bringing all those capillaries to those veins, here we're going to have lymphatic capillaries. They're going to drain into lymphatic vessels. Before we return to our heart, we're going to pass through these nodes, lymph nodes, and these lymph nodes are going to be where we can screen all of that lymph before we return it back to our heart. Now, depending on where this lymph is from, we're going to direct all this blood into two regions of the heart. If you are coming from the right arm, right upper trunk, and right side of the head, all of this lymph is going to drain into the right lymphatic duct into the right subclavian vein. Remember, here's that subclavian vein. Now, for the remainder of the body, if you are going to come from the left side of the body, the left arm, and the lower trunks, and the left side of the body, all of this lymph is going to drain into the thoracic duct, and it's going to enter into the left subclavian vein. So this slide definitely knows. So you should know where exactly it's going to be drained into. How exactly do we transport all of this lymph? Okay, so as mentioned, it's pumpless, meaning we don't have any contraction, just like our heart. We don't have any blood pressure or osmotic pressure forcing these through vessels, but it's actually a pumpless system. So only when you contract your muscles, anytime you walk, anytime you're moving, you create not only that milking action with your vessels, you're also creating that milking action within your lymphatic vessels. So not just cardiovascular vessels, but your lymphatic vessels as well. And remember that milking action here, your gastrocnemius, so we'll just imagine your calf muscles. This is your lymphatic vessel. As you contract your muscles, you're going to force that blood to flow in that one direction. And we have valves here found inside your lymphatic vessels to help catch all that blood from returning back towards your arterial bed. Now, how we can also move this in our thorax. When you breathe, you're also moving. So let's just go back over here. Okay, notice all of this, we don't have any vessels in this area, so as you inhale and exhale, you're moving your diaphragm. That in turn is also moving all of this lymph back towards your heart. And then finally, just like our vessels, we have smooth muscles lining the vessels in our cardiovascular system. Here we also have smooth muscles lining your lymphatic vessels. So we also have some movement in that sense by the contraction of your smooth muscles. Looking at these lymph nodes, this is exactly how we can relate the lymphatic system to our immune system. And it's because of these lymph nodes. So as we return all that lymph back towards our heart, we're going to filter all of that lymph into and by our lymph nodes. And why is this part of our defense mechanism? In our lymph nodes, here's our lymph node. Here are those vessels going into our lymph node. We have specialized cells called macrophages, and they're going to engulf and destroy anything foreign. And we also have lymphocytes, and this is the key to a specialized type of immunity that we have, which we'll get into next video lecture. And this is going to give us specific response to antigens, meaning that here is one type of cell. If we can say this is a bacterial, and this is your self cell, a bacteria cell will have certain surface markers that might be very different and unique compared to a cell that comes from our own body. And so because of this marker, these are called antigens. And antigens are these surface markers can uniquely identify something as foreign. And so anytime this comes into our body can recognize it as foreign, create more of these proteins called antibodies, and anything that we see in the body that looks just like this, we're going to attack, engulf it, and destroy and try to get rid of it in our body. Here we're going to take a closer look at all these lymph nodes, and if you notice, it looks just like a kidney shape. And we have two major regions of this lymph node. We have the cortex, which is this outermost layer over here, and then we have the medulla, which is this innermost layer over here. Now in this cortex, we find what's called follicles, and these follicles are these purple structures over here, and they contain specialized white blood cells called lymphocytes. In chapter 10, you learned that we have two types of lymphocytes. We have B cells and we have T cells, which are B lymphocytes and T lymphocytes. B lymphocytes, these are responsible for creating antibodies. And so in that last slide, we looked at these antigens on the surface of each of these cells. And these antibodies, once again, being those proteins found within your body that can recognize any of these surface markers as being foreign or part of yourself. T lymphocytes, what these are going to do is they're going to continuously circle in your blood and circulate within your blood and attack any cells that have these antigens that are considered foreign. And we'll get into the roles of these two next video lecture. Right here in the middle, we have the medulla. And in this medulla, we contain specialized cells called phagocytic macrophages. And what they do is they engulf and digest anything that's considered foreign or disease-causing, meaning pathogenic. And it can also engulf debris. And so if you look at your own cell, here's a cell from your body, so S meaning self. you have your own surface antigens. Each of your cells have their unique own. And if this is infected with a virus or a bacteria, this can also get filtered here, enter into your afferent lymphatic vessels, and then get engulfed by macrophages here within your medulla. And so what macrophages are going to do when we learn next video lecture is they kind of look like Pac-Man, where they're going to engulf the cell, so anything, whether it's your body or if it's something foreign, and it's going to chew it up, and then when it's done, this Pac-Man is going to present a portion of it on its cell surface. So it's going to hold a portion of this on the cell surface, and that's going to be interacting with these lymphocytes and other cells to see whether or not this is considered foreign and we need to attack it, or if it's considered part of your cell. This is especially true if this bacteria cell is, if your own cell is infected with a bacteria, and that can also alter surface antigens, and anything that has a surface antigen, your body is going to eventually attack. Another thing I want you to notice of this lymph node are the vessels feeding in and going out of it. And so here we have afferent lymphatic vessels, and it screens and brings all that lymph into your lymph node. And then coming out of that, all that fluid that gets screened is going to exit through the efferent lymphatic vessels. So A meaning towards, and then E meaning from. And also what I want you to notice is that we're going to have more afferent vessels feeding into your tube and into your lymph node compared to the number of efferent lymph vessels feeding out. And the reason for this is because you want to bring in a lot more fluid. You want to create pressure here within your lymph node, and by doing that you're going to be able to screen most of that lymph and really look for all that debris and pathogens. And by having less efferent lymphatic vessels, this is going to reduce and slow down the filtration, so it's going to not be able to flow as fast and remove all of that lymph, and thereby having the more thorough analysis of all of that lymph coming into your lymph node. Okay, we also have other lymphoid organs. So here we have other organs that can have those B cells and those T cells and those macrophages, meaning that they can also mount immune responses. And so we have the spleen, the thymus, tonsils, and Peyer's patches. Now, one thing I want you to know is that only the lymph nodes, right, only those vessels feeding into those lymph nodes will filter lymph. These other organs will not filter lymph at all. They only house those white blood cells, being those lymphocytes and those macrophages, to screen any of that dead and dying debris. Now, first one here we have in our pharyngeal region, that we have our nasal region, and right behind our nasal cavity and our oral cavity we have the pharynx. So this is the pharyngeal region where we have our tonsils. So this is that nice first area where we can screen anything coming into our mouth. We have the thymus. This is the most active during youth. This is for our T cell maturation. We have the spleen. This is going to curve towards our left side of our stomach. And then Peyer's patches we're going to see all throughout our intestines. Finally, we have the appendix, also in another area where we house white blood cells. But we're not going to go into the appendix in too much depth in this video lecture. The main function of the spleen is to filter blood, and by doing this we can destroy out dead or dying red blood cells. And so we can filter all this blood, remove any of that blood contaminated with bacteria or viruses, or even if there's debris within our blood. And we're going to return all those breakdown and products towards our liver. Specifically, we're going to look at iron and hemoglobin. And hemoglobin we can use to make bile. Bile, this is part of our digestive system that we're going to need to break down and emulsify our fat. Now, within the fetus, the spleen is the site for that red blood cell production. And also what's interesting about the spleen is that it can act as a reservoir for blood. So anytime that you're injured, you lose a lot of blood, you have a lot of blood loss, the blood will get spilled out from the spleen to increase your blood volume. Same thing with your liver. In the event of an injury or a lot of blood loss, your liver can also expel lots of that blood and increase your blood volume. Now, next region we have is the thymus. This is also going to peak during puberty. Produces a hormone called thymosin, and this is going to program lymphocytes to carry out their specific roles, meaning that it's going to tell whether the cell is going to be part of your body, so self or non-self. And specifically, we're going to look at T cells or T lymphocytes. So thymus, so you remember the letter T, and that's going to mature your T lymphocytes. Here is a cross-section of your thymus. Here outside, remember always outer layer is always going to be the cortex. Inner layer that's lighter here is going to be your medulla. Okay, so your thymus sits right above your trachea and above your heart. So the base of the thymus sitting right above your heart. Next region we have is tonsils, and this is going to be lymphoid tissue around your neck. Function is to screen anything coming into your oral cavity. So it's supposed to be that first initial form of defense. And here we have what's called tonsillitis, and this is inflammation and congestion of a bacterial and leading to this increased lymph nodes, swollen lymph nodes. And if you remember, anytime you bring in, you have lots of lymph, we can filter all that lymph through these lymph nodes. And anytime you have swollen lymph nodes, that's when your B cells are starting to produce lots of antibodies. And also if your macrophages are more have more activity because they're screening more and they're getting rid of anything that's foreign. And also if you might have more T cells recognizing these antigens. So anytime you have swollen lymph nodes, a common area where people also feel it are underneath their armpits. You have lots of lymph nodes there too. Here within your mouth, these are all those swollen nodes. Now, some people get their tonsils removed. Why is that the case? Well, if they have an infection, of course, this is going to be more difficult to swallow, more painful, and so by removing your tonsils, you don't have to deal with this, right? So anytime you have an infection. Now, of course, is this going to decrease your immune response and your immune system? No, you still have all these other lymph organs within your body, and of course you have those lymph nodes surrounding your entire body where you have those capillary beds. Next area we have are Peyer's patches. These are found in the walls of the small intestines. And before we cover the digestive system, what do you think the function is of your small intestines? Good. This is all for your absorption of nutrients. When we digest our food, we're going to absorb all those nutrients here within your small intestines. The only thing absorbed within your large intestines is going to be water. And so because we're absorbing a lot of these nutrients into our body, we also want to have Peyer's patches, meaning these regions where we're going to have lots of those B lymphocytes, T lymphocytes, and macrophages be able to screen anything entering into our body directly. So we can capture and destroy that bacteria or anything foreign immediately as it enters into our body. Now, if we look at these regions and areas that protect both our oral cavity and our digestive tract, so we saw those tonsils, we saw those Peyer's patches, everything stemming from our mouth all the way down to our anus. And also we have regions within our respiratory tract. Anytime we have a mucous membrane, we always have the potential of getting an infection because that's areas that are moist. They're nice areas for bacteria to start growing. And because of that, we also want to have lots of lymphoid tissues within these regions. So we have what's called mucosa-associated lymphatic tissue, which we abbreviate as MALT. And these are collections of lymphoid tissues that have those lymphocytes, macrophages, to protect both these digestive and respiratory tracts. So they include those Peyer's patches, the tonsils, and we have smaller regions of lymphoid tissue found within respiratory regions and the digestive regions. Now we're going to move on to the second region of this chapter, second portion of this chapter, looking at body defenses. And so if we look at our immune system can be broken down to two major categories. We have the innate defense mechanism, this is considered nonspecific, and that's because it doesn't matter if you're a bacteria, if you're a virus, if you are considered foreign or a part of your body, it doesn't respond to any of those surface antigens. It's going to act in the exact same way. And this is very different from the second part, or the second type category of the immune system, being the adaptive or specific defense mechanism, in which case we're going to look specifically for surface markers. And so what is the function of both of these? This immune system, whole purpose of this and the body defense is to protect our body against disease. Okay, so we're going to try to protect and create barriers for infection. Now, innate, this non-specific defense mechanism, this is divided into two subcategories. We have first line of defense and we have the second line of defense. So the first line of defense, this is a lot of the barriers, first line of non-specific barriers, so your skin, mucous membranes, secretions. Second line of defense, these deal more with cells, but these cells, they do not respond to specific antigens. They're going to treat everything the same. So these offer immediate protection against any threat, and this differs from your third line of defense. Now that we got past through these two lines of defenses, this is more specific. So we're going to look at specific threats and antigens. Now let's think about this idea of immunity. Immunity, once again, is a specific resistance to disease. And immunity, this deals more so with your third line of defense. And that's because your third line of defense is going to attack specific antigens, and we can create antibodies. And so the production of antibodies and also response by T cells, which we of course call T lymphocytes, to specific antigens trigger that immune response. Let's first look over this innate or non-specific body defense. And the way, I guess, if you think about a city, well, we can just think about a gated community. Okay, so first we have this gated community. And if you look at a gated community, a living community, what's that first line of defense to prevent other people from coming in? We have those security guards. We also have fences. So it doesn't matter who you are, whether you're resident or non-resident, you're always going to go through that security gate, right? So that's the same thing as this first line of defense. And so here within our body, we have body surface coverings, we have specialized cells, and we have chemicals to prevent anything from inhabiting our body. Let's look at the skin and mucous membrane. So this is that physical barrier. If we look at our skin is nice. We don't have any pores that directly connect the outside towards the insides besides our sweat and then our sebaceous. However, even our sebaceous glands and our sweat glands, these also form this first line of defense. Your sweat has a nice salt saline solution, and because it's saline, it's going to prevent anything from inhibiting or inhabiting that area. We also have, if you look at the mucous membrane of the vagina, that also has a very acidic environment. Sebum, this is that oil sebaceous secretion, that's also very toxic to that bacteria. And so these different secretions, very hospitable to trying to allow that bacteria to enter into our body. Now you remember, this is why it's so important when we looked in chapter 4, the repair of tissues. The moment you have a cut, penetration into your skin, then what happens? That exposes and increases the ability for anything to enter into your cell and cause infection. So we want to deny and prevent that access to those pathogens. Now other things within our digestive tract, anything that you swallow, the inner mucosa layer, we have hydrochloric acid. This is found in our stomach. This is supposed to initiate the digestion of proteins. However, this also is going to break down anything that's considered foreign. Your mouth, what does your mouth have? It has saliva, and also your lacrimal fluid, meaning your tears. Your tears also has very first line of defense properties because both of these contain lysozymes. And lysozymes, what are those they're going to do? They're going to destroy anything that's foreign. So it's going to start breaking down, engulfing, and start breaking things down. Mucus, also another type of first line of defense. Anytime you breathe something in, we can trap and engulf any dust cells, particulates trying to enter into our respiratory passageway. Second line of defense, now we have natural killer cells, inflammatory response, and phagocytes. And so these are, also antimicrobial proteins and your fever. And so natural killer cells, these can lyse and kill cancer cells. So natural killer cells, what it's going to do is it's going to go up to a cell. It's going to fuse and release some proteins into that cell, and that can cause a cell to lyse. So we can release a chemical called performance. This is going to target the cell's membrane, and when it targets the cell's membrane, it's going to create a little pore and allow all that fluid and then from the extracellular space to come in, causing that cell to lyse. Inflammatory response. Now this is something that we saw also when we looked at how the skin repairs itself. Anytime that you have a cut or abrasion to your skin, the inflammatory response is a method in order for us to reduce and increase repair. So reduce infection and increase repair. And so whenever your tissues are injured, you're going to see 4 common signs of what's called an acute inflammation. And so that's heat. The moment that you have a cut, what's going to happen? Your blood's going to start rushing towards that area. You want to release all those clotting proteins and create a blood clot. And this heat is generated because of that increased blood flow to that area. Remember, your blood is much warmer. Redness, also more red because, of course, you have more blood flow to that area. Pain, you've damaged your nerve receptors and your pain receptors, so that's why you see pain. And then swelling. Why do we have swelling? Well, when we have an increase of blood flow, we're also going to have an increase of white blood cells, of a lot of that serum coming towards this area. So because of that, we're also going to see swelling. Now, all of this collectively, we want to clot that area. So we're going to eventually lead to that protection and eventually healing to close it up and prevent any bacteria from coming in. Okay, so here are the steps to how we can heal the tissues to prevent it from having any of that bacteria and entering into our body. So this is that second line of defense. So here we have your cells are damaged. We're going to release kinins, histamine, and other chemicals. We're going to dilate our blood vessels, therefore increasing your blood flow, causing that area to become red and warm. Other things, our capillaries are going to become leaky because, why? We want to have all those clotting proteins enter that area. More edema, more fluid within that space. So more edema giving rise to pain and swelling. And of course, clotting proteins also attributing to this because we want to finally stop the exposure of pathogens to the underlying tissues. Another thing we have, so of course, function of this inflammatory response, we want to prevent the spread of those damaging agents and set that stage for repair, so the clotting process. Here is another example. So if you have anything entering into piercing your skin, now in this instance, what else can we have? We can have your macrophages. So this is when we have that leaky capillaries. Leaky capillaries are going to allow your white blood cells to enter into this area. So of course here we have that redness, we have swelling, we're going to have pain in this area, and of course we want to have your white blood cells also assist in this process of disposing of any bacteria that might have penetrated into your skin. And so this is the pathway of how those macrophages and white blood cells can enter into your underlying epithelium. So we have your neutrophils. Neutrophils being that white blood cell, being that first in defense anytime you have an infection. And it's going to cross from your capillaries. It can squeeze through your capillaries into your underlying tissues through this process called diapedesis. So diapedesis, this is kind of like ped, meaning like walking your feet. So this is that squeezing of that cell through the capillaries. So you can also think of it as like the walking ability of these white blood cells to go through your capillary pores and then enter into your underlying tissues. And then we have what's called chemotaxis. meaning here when the underlying tissue gets damaged, it releases those histamine, kinins, and so the movement of this white blood cell towards these chemicals is called chemotaxis, movement towards that chemical signal. So positive chemotaxis is positive movement, meaning that you're encouraging the movement of that white blood cell to that area. Okay, so here are those events of inflammation. Once again, you have dilation of your vessels. You're going to release histamine and heparin. You're going to attract those neutrophils. So we have that positive chemotaxis. We also have diapedesis through those capillaries. And then eventually we're going to clot that blood and assist and allow for that tissue repair. Phagocytes, we're going to talk about those white blood cells now even more in depth, being those neutrophils and macrophages. These are the neutrophils being the first major white blood cell to a site of infection. Remember, never let monkeys eat bananas. And for those neutrophils, we also have macrophages engulfing anything that's dead, dying, or foreign. And what we have inside those neutrophils and those macrophages are lysosomes. So lysosomes, again, being those enzymes that can fuse with any vesicles into your cell and can start digesting it and breaking it down. Okay, so diapedesis, once again, being that movement that neutrophils undergo to walk towards that damaged tissue site to clean up those pathogens. And monocytes becoming macrophages to dispose of that cellular debris. So here's an illustration of those macrophages. Here we have pseudopodia, extensions from that cell itself, engulfing anything foreign. So here we have foreign bacteria here in green, and it's going to bring it back into that cell and then fuse in that cell through endocytosis with that lysosome. Here are these steps, so something that you should know within the macrophage. So what's going to happen? We're going to have pathogens adhering to that cell surface. We're going to have endocytosis, forming what's called a phagosome. So a phagosome is this vesicle filled with this pathogen. We're going to fuse this lysosome with this pathogen, destroy it, and break it down, and then we're going to remove it from that cell. So a couple things. Not only are we just going to remove everything by the cell, but these macrophages, remember, it also has those nice arms, kind of look like a hand that's going to outstretch itself, and part of this is going to be found right over here. So we can present this to your T lymphocytes in order for it to mount an immune response. Now, other things we have, antimicrobial proteins. These will attack microorganisms to reduce their ability to reproduce. And we also have complement proteins and interferons. So how do these work? So let's look at complement proteins first. These are plasma proteins that once they come into contact with something foreign, it's going to create a pore and allow all that fluid in the extracellular space to come in and then lyse that cell. Now, what we also have are what's called, they can release vasodilators and chemicals that increase chemotaxis, meaning release chemicals that increase the ability for other macrophages, other white blood cells to come to that area where there's an infection. So anytime that you release these chemicals that increase the responsiveness of other white blood cells to that area of infection, this is called opsonization. And so opsonization also encourages and increases the ability to reduce the amount of that pathogen within that area. Here is that MAC complex. So let's go back here, this complement proteins. Why is this important? And let's see here in this next slide, it's because they can form things such as membrane attack complexes. Okay, so what is that? So here is this complement protein. Oops, sorry. Wrong thing. All right, so here we have complement protein. Remember, here is, let's just say, we'll make this smaller so we can see what we're looking at. Here's the bacteria cell. Here's an antigen. And antibodies will recognize these antigens. So this is a foreign cell. Here's the antibodies binding, so that's what you see over here, antibodies binding to that foreign cell. And these complement proteins are going to continuously be circulating within your blood. It's going to recognize your own antibody. Once it does that, it's going to pull in other complement proteins to this area to form what's called a membrane attack complex. And what this is, it's going to be a pore. It's going to form a pore. So these membrane attack complexes are going to form along this membrane of that foreign cell. And what it's going to do, it's going to allow liquid to rush on in. And then we can cause the cell to lyse. So eventually water is going to come in. Remember osmosis. Within these cells, we don't have a protective barrier to prevent it from lysing. So if you have lots of solutes in here compared to outside of the cell, water is going to rush in and cause that cell to lyse. Another second line of defense we have are interferons. And what these are going to do is it's going to interfere with the ability of viruses to continue to infect cells. So what does that mean? So that means here's this cell. It's now infected with a virus. And because it's been infected, it releases these interferons that will then bind a healthy cell. So this is a healthy cell. And tell it that, hey, a virus is coming. You want to protect yourself. So it's going to interfere with the ability of the viruses to come and infect this cell. And so by doing that, this cell itself is going to reduce the ability for viruses to infect it. So it's going to, by doing that, it can slow that spread of diseases. So it's kind of cool how that one really works. Whenever you get sick, what is the one thing that you start noticing? You have an increase in body temperature leading to a fever. And why this is the case is because of these white blood cells that are trying to fight off infections within your body. And remember, if you remember, never let monkeys eat bananas. Never let monkeys eat bananas. The three major white blood cells that we have, regardless of infection, they're going to be those neutrophils, lymphocytes, and those monocytes, which turn into macrophages. And so these white blood cells secrete what are called pyrogens. And pyrogens pretty much mess up the ability for the hypothalamus to regulate normal parameters of body temperature. So remember, at normal, we have about 37 degrees Celsius for your body temperature. However, when you get a fever, it goes up much higher. And so how is that the case? So pyrogens, it's going to over and supersede the ability for the hypothalamus to regulate normal parameters of body temperature. So it's going to say, whatever hypothalamus, I'm still going to have a higher body temperature, because why is that? Well, high temperatures reduce and inhibit the release of iron and zinc, and both of these are needed by the bacteria for them to continue to grow and divide. So we don't release iron, we don't release zinc from both your spleen and your liver. Now, it also increases the ability for your tissue to repair itself in the event that you might have had the infection due to a cut or injury and that bacteria has entered into your body. Okay, now the response to a specific threat is the third line of defense of the immune system. And this is immunology, is a specific study of immunity and how we can look at attacking specific surface markers and proteins and pathogens are by the use of antibodies. And all of this we're going to cover in next video lecture. Okay, and so that's it for the first part of chapter 12.